Knee pain. Sounds familiar, right? I'm sure all of you know someone who suffers from it, whether it is your grandparents, a friend, or maybe even yourselves. But what you may not know is that in most cases, the origin of this pain is a condition called osteoarthritis, a disease which in fact affects the knees of over 600 million people worldwide. Osteoarthritis hurts. It hurts so bad that it has become the 5th most common form of disability. And for the patients suffering from it, carrying out everyday activities such as walking or squatting becomes incredibly painful, or at least it used to be, because with the smart knee brace that we have developed, this will not be the case anymore. Our brace has been designed in order to provide adaptive unloading, meaning that the force that it exerts will vary according to the different activities that the user might be carrying out. This way, whenever the pressure across the knee joint changes, so will the unloading provided, allowing for pain relief in all kinds of situations. As of 2020, our serviceable obtainable market will have been of 200,000 people who could have benefited from treatment with our device. And not only this, but all indicators show that the prevalence of this condition will do nothing but keep increasing in the upcoming years. At the moment, we're looking to raise £2 million in order to get a patent and carry out the clinical trials. With your investment and our technology, we will be able to reduce the burden of this disease, helping to create a world in which knee pain does not sound that familiar. My name is Maria. Thank you for listening.
Thank you, Helen. How does your brace work and what's the size of it? I think that's one question.
The price?
The size.
Oh.
So how would it actively respond to the activity, and then what's the scale of the thing?
I cannot go into a lot of detail of that because we are yet to file a patent, but I can only say that it will read the movement of the knee and the leg and how it moves according to different activities and pressures that you put on it, and then adjust the force that is put in according to that data.
And then how much of the osteoarthritis market is purely knee? How much of it is other joints?
Okay, so the 600 million will be all knee osteoarthritis. And then out of those, our device targets medial knee osteoarthritis, or at least the first prototype will target that one, which is about 27% out of those initial ones. And then we will also be focusing on those people with a 2 to 3 scale on the Kellgren-Lawrence scheme for grading osteoarthritis, which would be another 70% out of those 27.
Hi, Maria. So I have a question about the patent filing. Did you also consider already which jurisdictions you're going to and how much budget you allocate for each jurisdiction?
So we will be filing in the UK, but through the EPO, and then in the US as well.
Okay. So straight to EU and US, so those will be your markets?
Yeah, primary markets, yes.
Okay, right, well, makes sense. And in terms of what you will be patenting, I know that you cannot go into the details, but I wonder if you can split up the components that you will be covering. Do you have an idea already? So it's a design. Yeah, can you go into that a bit?
Yeah, so we could do the mechanism itself, but the way we're designing the brace is going to be based on the mechanism as well. So we will probably be patenting the whole thing.
Okay, so you will link it to the mechanism and the way it looks, I assume.
Yep.
Design, I mean. Okay, all right, thank you.